everyone for joining the session. This is the first proper Blood Connect Get to Know You training session we are organizing, right? And I'm very happy to have you guys here and speak with you people on the session. We intend to have this session for about 45 minutes, and I would like this session to be interactive and not one way. And we have a pleasure of having Suman sir also in this session, who can help with any questions you have with the stories with about Blood Connect. We also have Acharan and number of other leaders who have joined the session. So feel free to ask questions. You can ask questions in the chat, and also you can unmute yourself and ask questions as required, right? So let's try to make this session as interactive as possible. Can you see my screen? You don't need to necessarily go through the slides, but if you're interested, you can look at the slides. My intention would be to make sure that I'm not reading the slides and making it as interactive as possible and in a storytelling mode, not necessarily, in a slide mode. But yeah, feel free to look at the slides if you want to. Have a look at the slides. The objective of this session is to tell you about blood donation, why blood donation is important, and to tell you about Blood Connect, a bit about history, how we started, why we started, what we do in Blood Connect, and then to tell you about our volunteers, our team, all of us, why our team is the most valuable thing we have, and why we want to work together as a team, and how can we work together, right? So blood donation, Blood Connect as an organization, and Blood Connect as a team. These are the three elements I do want to cover in the presentation. And as I said, I will rely less on the slides and more about storytelling. There is a short video about blood, but most of the time I've seen that people are not able to really access it on as joining from the mobile phone. So I will not go through the video, but I will come directly to about blood donation, right? Blood, and then I will connect to why we started Blood Connect, right? So roughly, all these numbers are rough, right? Roughly, there's a requirement of 15 million, or you can say 1.5 crore blood units in India, which translates into one blood unit in less than 2 seconds. That means in less than 2 seconds, someone in India needs a blood. That is a requirement, right? And out of that, there's a shortage of 20 lakhs, which means in less than 30 seconds, one person is not getting the blood required. Imagine every minute in India, two people are not getting blood on time when they need it. This is the gravity of the problem we are trying to solve. That's number one. Number two, thalassemia patients are one of the major recipients of blood. There are more than 1 lakh thalassemia major patients in India, and we are adding 10,000 per year. And these patients need blood every 4 to 6 weeks. Without that, their life becomes less what you would not want to. They start suffering with pain, ultimately leading to a death, right? So imagine about that. They need regular blood. So key things. Every 1 minute, two patients are not getting blood on time in India. That's a problem we are solving. We are adding 10,000 thalassemia majors every year, and these people need more than 100,000 units, new units every year. Overall, 1 million units are required by thalassemia patients. Right now, the question to ask is: we are a population of 140 crore. We need 1.5 crore blood units. Every person can donate 4 times a year. Now, assuming the blood can only be donated for someone who is above 18 years of age, and women are recommended to donate once in 4 months, not 3 months. Assuming all those things, The data says that we have more than 55 crore people who are eligible to donate blood in India. 55 crore, which means we should be able to get more than 150 crore of blood unit, 100 times of what we need, which means you only need less than 1% of the people to donate blood. Still, there is a shortage. Why? Number one, people are not aware of blood donation. Blood donation is one of the only social problem which is not discussed either in school or college. Blood Connect is one of the only few NGOs in the country that only work on blood donation. All other NGOs work on a lot of things, including blood donation, but that's a very small part of the problem statement. They work on education, health, hunger, all those things. And they do camps once in a while as a blood donation. So, blood donation as an opportunity, as a problem, is significantly underrepresented in the social sector because people are not aware of the need of blood donation. There's a lack of knowledge why blood is required. There are myths around it about getting weak, about getting ill. The myths around it that we should only donate blood when someone in our family need it, right? Why do we need to store the blood in blood bank, right? All those, because of all those things, the key being lack of awareness, we have a shortage of blood. Let me tell you, when I spoke with people, we Indians are very empathetic. We are very helpful to each other. So we are willing to come forward and help. The major problem is most of the time, either we are not aware of why blood donation is required, or we are not aware of where to do blood donation, or we don't know how to make it safe for a donor and for a patient. So, lack of knowledge, lack of awareness is the biggest concern for the blood donation in the country. There are other reasons, lack of infra. There are still more than, I think, 100 districts out of 760 in India where there's no blood bank, right? So, lack of infra is there, but I can tell you it has been improving significantly. Significantly, it has been improving. Lack of the infrastructure in India. And the blood donation as such has been improving pre-COVID significantly. When I started 20 years back, now it's exactly 20 years now. I started on this in 2003. India was collecting somewhere around 50 lakhs, 5 million blood unit. Now we are collecting around 13 million blood units. At that time, voluntary blood donation was 25%. Now, pre-COVID, voluntary blood donation was 88%. So, thanks to all the efforts by all of you that we have been solving the problem and we have been marching towards blood sufficient India through voluntary blood donation. COVID took us back by 5 years, but I'm pretty sure we can again work together to get one first pre-COVID situation and second really solve it. Now, I want to mention very quickly around why voluntary blood donation. That's a question that has come many times. Somewhere in 1998 or 99, Supreme Court made paid blood donation, which means paying a donor for donating blood illegal. And it is illegal in a lot of countries, not all the countries. WHO also say that blood donation should be voluntary. Why? We need to understand that very, very clearly. It is for the safety of a donor and it is for the safety of a patient. So when you donate blood, it goes to a blood bank. It goes through 6 mandatory tests, which includes HIV along with hepatitis and syphilis and other tests. 6 mandatory tests are done. However, for a safe blood, you need more than 50 tests to test everything, which will make it unviable to give blood to a patient on time, right? So most of the blood donation value chain rely on the, how do I say, it rely on the declaration by a donor, which are like, okay, I have not taken antibiotic in the past X number of days, I'm not drunk, I've not taken drugs, I didn't have a jaundice, I didn't have any other known problem, A donor declared that before donating blood, which to some extent ensure safety of the blood, to some extent, not the full. If your blood donation is paid, a donor is incentivized to speak a lie. When I started blood donation work in 2003, one of the key motivation for me was a long queue that you can see in Safdarganj Hospital and in AIMS outside outside just close to IT Delhi for a paid blood donors. These were the tired, very poor manual rickshaw pullers. In that time, there doesn't used to be electric rickshaws. Manual rickshaw pullers who used to donate blood every 2 weeks because they were getting paid with one blood donation, what they can earn in 3 to 4 weeks. They were getting paid 1,000 1,500 rupees per blood donation. And hence, they were either taking alcohol, drugs, unwell, they were dying because they were donating too frequently, right? And patient was also at a risk. That is the reason why a paid donation is banned, and we must always promote voluntary blood donation. Always voluntary blood donation. It is safe for a donor, it is safe for the patient. Remember that. Voluntary blood donation. That is why we say vision of Blood Connect is to make India blood sufficient through voluntary blood donation. I can tell you if we start paying for blood donation in India, shortage will not be there because there are too many poor people who would donate blood to make easy money at the cost of their life and at the cost of the patient life. Right. So this is the vision statement with which Blood Connect was started exactly 13 years before now in 2010. So first of all, congratulations to everyone that we have completed 13 years. Yesterday was a Blood Connect Foundation Day, right? And we have done awesome job on this, or for the blood connect, blood donation. We have organized more than 1,200 camps, collected more than 100,000 blood units, more than 20,000 blood units by sending the patients to blood banks through during emergency. We have organized more than 1,000 awareness sessions. We have reached out to more than 10 million people, and we are one of the only NGOs in the country that is only focusing on blood donation and fully 100% volunteer driven. So there's a lot that we can feel proud about, and we must feel proud about as an organization that we have achieved. And we could not do that without the support of thousands of volunteers like you that give your time for this cause. So, hats off to all of you for giving your time for this cause to help people where no one else is coming forward. I will stop here if there's any questions. There's a lot of material around what is thalassemia, what are the eligibility criteria for blood. We'll share the slides. I can quickly touch on that, right? But I want to touch more about Blood Connect story, what we are as an organization, what we do as an organization, and less on the technical aspects of what is thalassemia. But before that, any question you have? And before that, Suman sir, you want to add anything on blood donation? And before that, let me say that we have made a lot of progress in science, right? Lot of progress. We can even make an artificial heart now, liver, most of the body parts we can make. But unfortunately, we have not managed yet to make, even at lab level, forget about commercial level, any component of blood, forget about whole blood. Nowhere in the world, no one has successfully managed to produce any component of the blood, even at lab level. Which means if the blood is required by any one of us, anyone, the only means is by taking the blood from our fellow colleagues, fellow human beings. So there is no substitute for blood in your body cannot survive for the blood, and there is no substitute for a blood donation by other citizens, by other human beings, if a blood is required. This is how important blood donation is for every one of us, right? And I will come to a important distinction between camps and helpline and how can we make India blood sufficient. But let me really stop here now for Suman sir to add something quickly, and then for anyone else to add or have if you have any questions. Suman sir, आप म्यूट पे हो सर. Suman sir, you want to add anything? You're on mute. Okay. सर को आवाज नहीं आ रही है. Any question anyone has at this moment?
No, sir, all good.
Awesome. Good. So let's spend a minute on thalassemia, right? We talked about it. It's a blood disorder, right? And it's a one of the key disorder which need a regular blood transfusion, right? This disorder results in large number of red blood cells which get destroyed, which leads to anemia, right? Which leads to imperfect oxygen in the body, right? So you have to replace those red blood cells that are getting destroyed by putting the new blood frequently in the patient, right? The key thing here is you would want to make sure that because this blood is getting replaced every 6 weeks, this blood is coming from a known safe donor, right? Because every time you replace your blood from someone else's blood, it does not match your own body blood exactly. So there's a requirement that it comes from the safe donor on this. You can see here there's a theory around, father and mother. How can we reduce thalassemia patient in India by checking the thalassemia for the couple before marriage, right? Because it's an inherited disease from your parents, from the parents, right? Where if both father and mother are thalassemia minor, it can result in either someone with kids being a thalassemia major, right? The probability of 25%, or even a normal, norm without any disorder, right? Or a kid being a thalassemia minor, which does not need blood transfusion and can lead a normal life. So the way to protect that is if thalassemia could be detected before a marriage, right? And a right decision can be made for the future of the next generation before marriage. It's easier to say than to do, but I don't want to spend the session on this. I want to really spend the more session around blood donation right now. So, but if you have any questions on thalassemia, feel free to ask. Feel free to ask. Happy to answer any questions on thalassemia on that, right? Quickly on the eligibility criteria. So, and this is the one thing that everyone of us must know. There's a long list of eligibility criteria, long list, right? But these are some of the very basic things. Every man can donate in 3 months, women in 4 months. This is guideline from Ministry of Health in India, and this is for the whole blood. For the platelets, for the plasma, for the RBC, the guidelines are different, right? Platelet donation, you can do technically after 48 hours, but recommended 7 days. After 7 days you can donate the platelets. Between platelet and whole blood, 28 days are required, right? Tattoo should wait for at least 6 months. Now, why is that? Number of people have asked me why there's a requirement to wait for 6 months from tattoo. The problem is in India, when you're doing a tattoo on your body, there's a very, very high risk that the syringe or the needle being used for tattoo is not sterilized. Very, very high risk, which means there might be certain type of infection, not really fatal, not really very dangerous, but certain type of infection, unknown, which might be in your blood, for few months after you have done tattoo. So waiting period after tattoo is really linked to unsafe, potentially unsafe needle used for tattoo making. That's the reason there is a waiting period of 6 months after tattoo. Age 18 to 65, first time donors not more than 60 years, but if you have donated before, you can donate up to the age of 65. And minimum weight is 50 kgs. Some blood bank also take 45 kgs for women, right? So you can say 45 to 50 kg is the minimum weight requirement. Minimum hemoglobin 12.5, very important. So if you're donating blood, or if in any of the blood bank, blood connect camp, hemoglobin is not getting tested, feel free to make it mandatory. Tell the blood bank, please test hemoglobin. There is no reason that blood bank is not taking blood pressure or a weight or a hemoglobin before taking blood. There is no acceptable reason whatsoever. Not having a kit is not an acceptable reason. It is our responsibility as a blood connect. We make sure that three things are tested: weight, blood pressure, and hemoglobin for every blood donor in our camp, right? Alcohol 24 hours. If someone has taken alcohol within 24 hours, advised not to donate blood. And it is also advised not to consume or not to smoke at least for 3 hours after donating blood, because that can increase, uh, that can change the blood pressure, smoking. So that's also advised on that. Any questions on this? Any questions anyone has so far? Suman sir, you want to add anything before I move to the next? आप म्यूट पे हैं सुमन सर, if you want to speak. Can you guys hear me?
Yes, sir, we
Yes,
can
sir.
hear you,
Yes,
bro.
sir.
Okay. Okay.
Yes, sir.
Awesome. Okay. I thought मेरी आवाज नहीं आ रही. Okay. Good.
No, no, sir. All good.
Okay. Let me see. So, Suman sir. Okay. He is probably not getting the voice. So let me. If you have any questions, please feel free to write in the chat box, right? And then we will take care of your questions. We go. Next section is really about blood connect. I briefly want to tell you about, you know, blood connect, what is our goal, and also I want to take the point around how do we make India blood sufficient, right? Is it through helpline? Is it through camps? How do we create awareness? But before that, very quickly about blood connect, right? So set up in year 2010 as a project under National Service Scheme NSS in IIT Delhi, with an objective to make India blood sufficient through voluntary blood donation. Few years after that, we registered Blood Connect Foundation as an NGO, as a trust in India, with an intention to be able to help people across India. And for that, we have to register ourselves as an NGO. Since 2010, we have organized more than 1,400 blood camps, collected more than 127,000 blood units, managed more than about 30,000 now blood helpline requests, reach out to 10 million plus people. We have worked with thousands of volunteers from hundreds of colleges across India. Across India. Every year, we have around 100 to 200 active members working with us from more than 30 colleges across India. And let me tell you, Blood Connect is not just about people in colleges. Blood Connect is about youth and also old people like me, who are touching their 40s. So it is a youth driven campaign where we have people working in organizations. We have Suman sir who is a professor. We have Acharan who is working in Reliance. We have Mansi who is working Tata Motors. We have number of working employees. We have Anisha who is working at TCS. That we have Nitish who is working KPMG. We have now number of working professionals supporting us, and that's the beauty of Blood Connect. It's a youth driven. People continue working with us once they go from the college to a company. They continue supporting us, and people who are working in the companies also join us. It's a youth initiative to make India blood sufficient. What is our goal? We are right now somewhere around 15,000 blood units per year, somewhere around that. We want to reach 100,000 blood units every year, and we can do it. I think we would have already achieved it if COVID would not have hit. We would have already achieved it. 100,000 blood units per year. We want to promote regular blood donation, which means we want to encourage people to donate blood at least twice a year, if not four times. Currently, unfortunately, data says that more than 90% of the donors only donate once a year. And out of those 90%, more than 60% of the people donate twice or thrice in their entire lifetime, not also once every year. Which means we have a hard goal of convincing donors every year to donate again and again and again. We have to find more donors every year. It will be good for the safety of the patient, and it will be good to make India blood sufficient if we can do something to increase the number of regular donors, which means first someone donating every year, then someone donating twice a year. We have not managed to crack it. Let me accept it. We have not managed to crack it. And I need all of you to give ideas, to come forward with ideas how to do it. The success to make India blood sufficient is by encouraging people to donate regularly. That's what we have to think. What do we do? Do we create a programs where we encourage people to donate in their birthday month, in the birthday month of their loved ones, boyfriends, girlfriends, husband, wife, kids, right? Once a year. That will be a good start. Can we do that something around it, right? So when you think about making India blood sufficient, don't always think about how to do something, how to get more new donors. That's important. Also think about how do I get my old donors donate again, once, twice, thrice, four times every year. How do I get them? Second, how do I get blood connect to every college in every city in India? Can I organize one camp in every college in India? If not directly, can I encourage them to organize it? They don't need to do that necessarily with Blood Connect. Can I support them through a pan India team or otherwise? Tell them why to organize a camp, how to organize a camp, and let them do it, right? That will help us make India blood sufficient on this. Again, if you have any questions, feel free to speak, right? Let me now touch very briefly on helpline versus scam. We organize. So what do we do? We create awareness about blood donation. We organize camps, and we also manage helpline request. And we have reduced doing it over the time. We were spending 80% of our resources in managing helpline request. Now we are doing probably 15 or 20% of our resources in managing helpline request. And we are focusing a lot more on organizing camps, lot more, and spending less time on managing helpline request. The question is why? Now, let me give a scenario. If I need a blood today, what would I want? I would want blood to be available in a blood bank. I can go there. I can say, this is my requisition slip by a hospital. I need a blood. They have enough blood in their blood bank, and they can issue me a blood after taking a required fees for processing it, whatever it is. That's a one scenario. Second scenario is blood bank is always short of blood because there are not enough regular donors or they are not getting enough camps. And hence, They tell me that we have a blood that you need, but we are only going to issue you the blood if you bring one more donor replacement. That's what we call replacement donation. In helpline requests, 95% of the requests are with from the replacement donation, which means blood bank will only issue the blood if someone else will go and donate blood, because they were not getting sufficient blood donors or blood donation camp. That's a second scenario where I will, when I need the blood the most, when someone in the hospital is suffering, needs the blood, I'm actually making calls. I'm actually trying to find a donor. I'm wasting that time, critical time. What would I want? I would want a situation where blood bank will always have blood, and they will not waste their time calling units. They were only asking for one replacement unit. They were getting so many blood donation camps that they had a regular supply of blood donation, and hence the requirement for replacement donation did went down, did go down. That is the reason we at Blood Connect strongly believe that if we have only 2 hours in a day to work, the maximum value we generate is by organizing a blood donation camp and collecting 50 units, so that when someone needs a blood, he or she is not running from pillar to pillar to arrange that blood. We want to make that blood available in the blood bank. Now, if we would be a big organization, we would do everything. We'll organize camps, we'll handle all helpline requests, we'll do awareness session. Unfortunately, we are not that big that we can do everything. So what we are trying to do, we are trying to see with our resources, where do we create maximum value. And we also maintain database for the rare blood groups, so that if the blood is not available, if it is real emergency, right, we try our best to call the donors from the database, from the network, because we know how to do that, right? And send the donor to the blood bank. So we have not stopped helpline, we have reduced it, and we have reduced it so that we can help more people through blood donation camp. Our helpline will focus on rare blood groups, real emergency cases, so that we can spend time on blood donation camp and creating awareness. Number of people have asked me this in the past, and that is the reason I've repeated myself on this point. I will stop here again. Any questions you have on this point? Any questions? Please do ask, because I am pretty sure I'm not 100% clear. I am pretty sure this is a confusing matter, and I'm not 100% clear on this. So please ask if you have any questions. Don't hesitate. Write in the chat box, and that will also give me certain confidence that some of you are hearing, and it's not just you have logged in and doing your own stuff, right? So do ask, right? I will speak for 5 more minutes, and then I do want to ask if Suman sir or Acharan want to add something, and if you have more questions on that. Thanks, Rishabh, to give me confidence that yes, you're listening, right? And the 5 more minutes, good, good to know that other thumbs ups. 5 more minutes are more about team, more about congratulating and celebrating what we did as an organization, more about our value for all of you, how valuable you are for all, for organization. I'm also a volunteer, I'm also one of you, and together how valuable we are. COVID was something that took blood donation back by 10 years. In 2020, and I'm not really, and Achran or Suman sir can probably add, right? And I'm not sure if Anisha is here, she can add. I'm not really, exaggerating that. In 2020, when lockdown happened, in March 2020. Before that, also, a lot of our camps started getting cancelled. In March, I know 9 or 11 of our camps in March 2020 got cancelled because of COVID, right? And when lockdown happened, me and some other fellows were discussing, can we do anything now? And we took few days, and then we started getting a request that the blood is really running short. Now, again, think about thalassemia kids. Due to COVID, optional surgeries were not happening, but accidents, pregnancy related surgeries, thalassemia related transfusion was still happening. So what we learned within few weeks was 75% of the blood requirement is still there. You can't tell a pregnant woman that, hey, there is a lockdown and hence you cannot deliver baby because we don't have blood. That is irresponsible answer to a pregnant woman, right? You can't tell a thalassemia kid, 5-year-old kid, hey, we know you need a blood, but we have a COVID, we have a lockdown, and we have no donors. You can't get a blood. So hell to your life. That's not an answer we can give to a thalassemia kid. And blood bank were really running dry because there were no camps happening. Colleges were shut, corporates were shut, everything was standstill. Everyone was fearful. As an organization, as a Blood Connect, we can make an excuse and we can say, guys, government imposed, lockdown. We can't do anything. We're shutting our shop. We are running away from the problem. But no, I'm very, very proud to say that the team at that time said, if we are not going to work now, if we are not going to step up now, what is the point of having organization? We can't let people die because of blood shortage. We stepped up. We engaged a lot of government departments. Very soon, government saw the problem. They came with an advisory on how to organize blood donation camps during COVID. We partnered with the private blood banks, the charitable blood banks, because all the government hospitals were getting converted into COVID centers and the blood banks were not keen to come. And within 2 weeks, I think on 8th of April, within 2 weeks of lockdown, we organized first Blood Connect only camp in a residential society in Gurgaon. We said, okay, where are people now? They're in their houses. Can we organize a camp in RWA? We were fortunate to get a very like-minded person, Hitanshu Gandhi, I still remember his name, who said, let's do it. Let's do it together. We organized the first camp there. Achran managed it along with the team in Delhi, along with the charitable blood. Very, very well. That and that's the beauty of our team. We stepped up to the effort. We took all the necessary care to make it safe for the donor. In that camp, the blood donation chair was at 3 meters. After every donation, it was fully sterilized. Everyone was double masked, temperature check, everything. We took all the precautions. I'm very proud to say that in the last 3 years during COVID, we did 485 blood donation camps. In 2020 and 2021, we did maximum number of blood donation camps in any year. That's how hard you people work when there is a real problem. We did not get same number of blood units. People were feared. I will not say that we collected same number of blood units. We could not. In a camp where we were collecting 100 units during COVID, we got 30 units. We had camps in during COVID in Delhi where we collected 5 units in a day. Team was demotivated, but they didn't stop working. 5 units in the full day. We didn't stop working. We had so many challenges, but we didn't stop working. Right? That's the team. That's the blood connect. That's how we step up to the challenge on this. Right? So again, I will not really go back to all the precautions we took in detail, but I will quickly mention very quickly about the mass awareness campaigns that we used to do earlier. We have to start doing again, which was in 2013 at Kurukshetra University. We created the largest human blood drop, which is 3,000 plus students standing in the shape of a blood drop, right? And we organized 10 camps in 7 days. It was a world record at that time. We could not get our name in the Guinness record book because we could not give them notice in advance. It's no longer a world record now. Someone else in, I think, Indonesia or somewhere else has beaten it. But at that time, creating the largest blood drop with 3069 was a world record. It created coverage in more than 50 newspapers and channels, getting more than million views and mobilizing 30 plus colleges to work with us on this. We created significant awareness through that campaign. That's how we mass awareness, right? Blood Connect is known for the innovation. Again, this is one point where I do want to spend a minute. Blood donation is seen as, you know, unhappy thing. Blood donation is seen as, is linked to illness, is linked to someone not well, unwell, is linked to forceful, that we are forced to do it. Whereas blood donation is about courage. Blood donation is about giving. Blood donation is about saving lives. Blood donation is about love, making relationships. And blood donation is also about healthier yourself. There's a proven research that the regular blood donors are more healthier. And I can send the article. And our ex-health minister has mentioned that several times. It's a proven research globally. Blood donation also helps a donor. So, and Blood Connect has taken a pride in making blood donation a fun thing to do, not a sad thing to do, by making our camps innovative, right? You see some of the photos that reflects that. So, guys, when you organize a blood donation camp, when you talk about blood donation, keep it in your mind. It's a good thing to do. It's a happy thing to do. It's not a sad thing to do. Position blood donation as a event for which you can feel proud about, not sad about. And we have worked with hundreds of corporates, large, small, with now more than 100 blood banks. As I said, hundreds of colleges. We have even stopped tracking all of them across India. So won so many awards, right, from government in different states, including health minister. We have won the award, right? So coverage in all the major newspapers you can think about. So remember, we are a volunteer-driven organization. We don't have employees, but that does not mean we're not recognized and we're not a valid. We're a proper registered trust with ATG, 12A, CSR, registered office, committed people, all the things we need, right? So feel proud about being associated with an organization which is running for 13 years, which is saving lives of more than 400,000 people and is well recognized for all the good work all of you are doing, right? Now, coming to it, right? To volunteers, you are everything for us. We have no offices. We don't sell any product. We don't take a single rupee for providing our services. It is free for everyone, for donors, for corporate, for awareness. We don't charge anyone any money for organizing blood donation camp. We don't charge anyone anything for sending a donor, right? So we don't make money. Who is a resource? You, volunteers. And we celebrate that, right? We celebrate that by working together, by eating together, but also by awarding people who do the best job, best volunteer, best team that has collected maximum number of blood units in a year, the person who has done the best work in a month, in a year, right? We celebrate them by giving awards. We celebrate that team, recognizing them for the award by giving them awards. because we want to make sure that together we're achieving the mission, but we're also celebrating our achievement. We're celebrating the good work that all of us are doing through awards and through parties. So it's all about fun as a youth. It's not just about work, right? You know most of the leaders that we have here. I will not spend time on going through the name. And we have many, many more leaders than the names you see here. And I really feel proud of working with these leaders in taking the journey together that we have. So, together, help us collect more blood, help us spread the word, and help us in supporting those in urgent needs. Three things: more units voluntarily, by more camps, more in-house donation, spread the word, get more people connect with us as a member of Blood Connect. Get them connected. If nothing else, they will know about Blood Connect and blood donation. Get your friends connect with us in your college, in other colleges, right? And support those who need blood urgently by donating yourself, by encouraging your friends to donate, and by helping calling people from a database to donate. Right. I want to really stop now. I think there's a question that is there. One second, which is, how do we ensure that people who need blood are getting it on time and bloods are not being theft? Are there a tracking system? That's a good question. There are things have improved significantly, and let me say that blood is still getting sold, and there's still a bit of a theft, but reduced significantly. There are tracking systems in most of the blood banks now. Most of the blood banks are becoming digital now, with the track number of units coming in and number of units going out. But still, there's a blood getting wasted because there's no proper storage and it's getting leaked. But that percentage is less than 5%. So the problem is there, but the problem has gone down significantly. The way, and let me answer this, the way to ensure that a patient is getting blood on time is the making sure that blood bank has enough blood. Because if blood bank has enough blood, there is no reason for the blood bank not to issue the blood to the patient, because blood has a limited life. If they will not issue the blood to the patient, they will need to throw it, which is a waste for them of money, because they need to spend the money on the blood bank and processing it. So if blood bank gets enough blood, they will always try to issue the blood to a patient without a replacement donor. Unfortunately, most of the blood banks in India are struggling to get enough blood through voluntary blood donation. That's an unfortunate part, and hence they ask for a replacement donation.
Uh,
Right.
I would like
Yeah.
to add one more point.
Yes, Mansa, please.
इंडिया में माफिया तभी आता है कि जब शॉर्टेज होता है. इवन ड्यूरिंग द कोविड पैंडेमिक रेमडेसिविर का माफिया चल रहा था. क्यों? रेमडेसिविर की स्टॉक नहीं थी. मतलब जब स्टॉक हो जाता है, ये अपने आप खत्म हो जाता है. इधर मिसयूज इसलिए है क्योंकि शॉर्टेज है. अगर हम वॉलेंटरी ब्लड डोनेशन को एनकरेज करें, ये अपने आप खत्म हो जाता
Exactly. This is a very, very valid point, Suman sir. अगर shortage खत्म, माफिया खत्म. क्या करेगा माफिया? If there's enough blood, they can't blackmail the blood, because people will say, "Ah, we have enough blood. We don't need your blood for 5,000 rupees because we are getting blood from the blood bank with the government processing charges." Right? So very, very valid point Suman sir has mentioned. If there is no shortage, there is no mafia. There is no mafia. It is safe for the donor, safe for the patient. Everyone is happy. We only have 5 more minutes, and I do want to hear from people on the call, the part you liked, the part you didn't like, any questions you have, anything else you want to hear. Achran, Nitish, Vaishnavi, feel free to add anything. Floor is open. Suman sir, feel free to add anything now. And I would love to take a feedback on what do you want to hear from us about blood donation, about Blood Connect, about anything else. How do you want to organize these sessions in the future? Did you think these sessions were useful, not useful, should be short, should be done at some other time, should be done face to face? We are a learning organization, and we can only solve the problem together by learning from each other. So feel free to give the feedback directly, indirectly, to anyone. I'm shutting my mouth now. And over to Vaishnavi, you and Monal for taking questions, and to Achran, Suman, sir, Nitish, if you want to add anything.
I would like to add a very small points. Uh, कि 10 years back almost कि हम बहुत रिस्ट्रिक्टेड होते थे, नया चीज सीखते ही नहीं थे. बस ब्लड कनेक्ट मतलब मैं सिर्फ हेल्पलाइन ही हैंडल करता था. आई वाज नॉट इंटरेस्टेड इन लर्निंग मोर. तो अपने आप को एक सैचुरेशन लेवल पे ले जाके बैठ गया. वन फाइन डे आई गॉट अ कॉल फ्रॉम वन ऑफ द टीम मेंबर दैट कि वो कुछ कंपनी के साथ कोलैबोरेशन में जा रहा था और वो नहीं जा पाया, एंड दे नीड समवन हु कैन अटेंड द मीटिंग. And since I have restricted myself only to helpline and operations, I don't know much about how to represent Black Connect at a company level at that time. But still, I went to that company and they started asking me many questions about Black Connect. कि आप कैसे इसको एक्सपैंड करोगे, कैसे आप हमारा रीच बढ़ा दोगे, टाइप का कॉर्पोरेट लेवल का एक अलग सा क्वेश्चंस मुझे पूछा गया था. हम आंसर नहीं कर पाए थे. बट व्हाट आई डिड वाज दैट कि हमने उनको ये कन्विंस कर दिया था कि हमारा दूसरा टीम मेंबर आके आपको ये बात बता देगा. विथ ग्रेट डिफिकल्टी मैंने उस दिन उनको कन्विंस किया था, बिकॉज आई टोल्ड दैट कि मैं एक पीएचडी स्कॉलर हूं, मैं सेकेंडरी सपोर्ट दे रहा हूँ, ग्राउंड लेवल वॉलंटियर्स कोई और है कर. लकीली नेक्स्ट डे वो वॉलंटियर वहां गया और वो कोलैबोरेशन सक्सेसफुल हुई. एंड फॉर द नेक्स्ट 4 years the same organization sabic करके है गुड़गांव में, they gave us lakhs of funding in lakhs of rupees for the next 4-5 years till the pandemic struck. अगर मान लो उस दिन मैंने थोड़ा बहुत मैनेज नहीं कर लिया होता और नेक्स्ट डे हमारा वॉलेंटियर जाके उस कोलैबोरेशन को नहीं बचा होता, तो हमारे ऑर्गेनाइजेशन को उतनी फंडिंग नहीं मिल चुकी होती, हमारा ऑर्गेनाइजेशन इतना ग्रो नहीं हो चुका. सो द टेक अवे इज हर एक वॉलेंटियर को ब्लड कनेक्ट के हर एक हिस्से के बारे में जानना जरूरी है. आफ्टर दैट रियलाइजेशन आई स्टार्टेड एक्सप्लोरिंग every department of blood connect, having basic idea about what every volunteer is doing. And in fact, I came to this session again because I want to know the new kinds of questions what volunteers are asking, because if a volunteer is asking a question, tomorrow someone else will ask me. So I want to keep myself updated. तो मैं वॉलंटियर्स को ये एक्सपेक्ट करता हूँ कि आप भी अपडेटेड रहो अपने डोमेन में, रिस्ट्रिक्ट मत हो जाओ, सीखते रहना नए नए चीजें, बिकॉज द वर्ल्ड इज चेंजिंग डायनामिकली. एवरी डे इज अ न्यू डे फॉर अस. सो एंड आई एम डन विद दिस.
Awesome. Thank you, sir. I think very quickly there's a question around how do we get funds. So Mansur has mentioned we used to get funds from CSR, corporates, small amounts. We get less of it now because of different reasons, COVID being one of them. We raise funds through crowdfunding, and the fundraising campaign just ended 2 days back. We raised funds in March, asking people to donate funds to us for us to help organize camps and also manage the team activities, right? So most of the funds comes from the crowdfunding from the people like us, including myself and others in the chat donating. And we also do pitch to the corporates, but we have not been very successful in raising the fund from the corporate in the last 2 years because of a number of things, COVID being one of the major thing, and I can explain that later if someone is interested. But if you have any connection the on CSR, please do connect. We have all certificates required to get CSR funding, including CSR registration. We have everything that a corporate would need to give funds to us. And our funds goes 100% into activities and zero for salaries. That's the beauty of using our fund for us. No office expense, no salary expense, all for the cause and for the team. Okay, we are out of time now. Thanks a lot for joining. Monal and Vaishnavi, handing over to you. I really enjoyed giving the session. I hope you also enjoyed listening to me and were not too much bored. But if you have any questions, feel free to write to me. If you want to write to me directly, I am giving my email ID on the chat box, right? And I will do my best to reply to all of you for the questions, right? This is my email ID. Feel free to write to me if you have any questions, any suggestions, any feedback whatsoever.
Vaishnavi, please send this presentation to me. I want a copy of this presentation.
Yes, sir.
Sure, sir.
Thank you, Vaishnavi. To you
Mm,
and
yes, sir.
anything.
Thank you so much, sir, for the session.
Good. Thank you, everyone. Bye.
Thank you everyone. Bye bye. Take care बच्चों.
Bye bye.
Thank you, sir.